Video 1, Pleural Effusions and Management Options. This video will discuss pleural effusions, signs and symptoms of pleural effusions, and options for managing malignant pleural effusions. A pleural effusion is an abnormal buildup of fluid in the space between the lungs and the chest wall. This area is called the pleural space. Pleural effusions can be caused by a number of different reasons, some of the most common being congestive heart failure, pneumonia, pulmonary embolism, or a blood clot in the lung, and cancer. For this video, we will focus on pleural effusions that are caused by cancer. When cancer cells grow in the pleural space, it can cause what is known as a malignant pleural effusion. Malignant, which means cancer-related, pleural effusions are a common complication in a number of different cancers. Relieving these symptoms is one of the most important parts of cancer care and treatment. Individuals with a malignant pleural effusion may experience the following symptoms: shortness of breath, chest pain when taking a deep breath, cough, weight loss, fever, and fatigue. There are 3 options available to patients with malignant pleural effusions to help relieve their symptoms: thoracentesis, talc pleurodesis, and tank-off catheters. Thoracentesis. This is a procedure in which your lung will be drained during a clinic visit, and you will be sent home after with no drainage tubes or devices attached. The advantages of a thoracentesis is that it is a relatively easy, painless outpatient procedure that can help you feel less short of breath. The main disadvantage is that it does not prevent the fluid from building back up, and you may need to come back for repeat drainages. Talc pleurodesis. This is one of the definitive management options that is available. This means that this could help prevent fluid buildup from happening again in the future. During this procedure, the fluid from the lung space is drained, and a chemical agent, known as talc, is administered into the chest space through a chest tube. After the chemical agent is instilled, a reaction happens inside that causes a pleural inflammation. When this happens, the lung is working to restick itself, like glue, to the chest wall, preventing fluid from building back up again. The advantages of this approach, if successful, means that you will have this one procedure and will not require other invasive interventions, such as a thoracentesis or repeat hospital visits again in relation to the fluid buildup. The main disadvantages is that the patient needs to be in the hospital for a minimum of 3 days, and there may be a temporary drop in oxygen level. Additionally, some individuals have complaints of pain and the occasional development of a fever. It is important to know that there is no guarantees that this procedure will work, meaning there is a chance for fluid buildup again in the future. Tank-off catheters. This is another definitive management option available to patients, and the focus of the next few videos. A tank-off catheter is an indwelling pleural catheter, which is a small tube that is placed under the skin and placed into the pleural fluid, allowing for repeat drainage at home to relieve symptoms. These catheters are placed using local anesthesia at the site of insertion as an outpatient procedure. The catheter is safe, easy to use, and may help the lung to eventually expand and restick itself to the chest wall, preventing fluid buildup from happening again. The main disadvantage is the need to care for the catheter, in which we will provide an instructional video on how to perform the care safely in video 3. If you have any additional questions and would like more information about the other management options discussed, please speak with your physician to get up-to-date information to help you make the best decision for yourself. Please click on the next video to learn more about tank-off catheters.